yesterday, and a total of 4,076 deaths. That is 32 more that reported in the last 24 hours. ABC 6's Jeff Reddick is covering the governor's briefing today. And Jeff, we should get an update on the alert levels, as happens every Thursday. Are you hearing anything about changes here in Central Ohio?
Well, we do know that we've been in alert level 3, the red level, since this all began. And the reason you go to the red level, Terry, is when you meet 4 or 5 of the state's 7 criteria that they measure by. Now, we in Franklin County are actually down to 3. So ideally, we would be down out of the red already. The problem is we're still hitting a CDC level for number of new cases per 100,000 people. That's what keeps us there. We have, as of last week, 109 new cases per 100,000 people in Franklin County. If we can drop below 100, it's likely we'll go to the orange, and you'll start seeing some changes with schools at that point.
Absolutely. So if we do see any changes from red down to orange, because orange is the lesser, as you said, do you think that'll cause any school districts to change their online plans at this point?
Yeah, we expect that to. There are districts we know, such as Dublin and Upper Arlington, that had based their system on that map. I see the governor's up now, and maybe we'll hear more from him.
I'm wearing today red tie I have on is Owens Community College. They have campuses in Toledo and in Findlay. Couple bad pieces of news. Cheryl Boyce, who served as the executive director of the Ohio Commission on Minority Health for 24 years, died on Tuesday. She was a pioneer in the fight for equity, health equity, in Ohio and really throughout the nation. She also served as a role model and mentor to countless other professionals pursuing the important work of correcting health disparities. Our thoughts and prayers go out to her husband, Russell, her daughter, Dr. Ebony Carter, and the rest of the family. Yesterday, we lost one of our nation's heroes and one of Ohio's heroes. Fran and I were saddened to hear of the passing of United States Army veteran and Medal of Honor recipient, Ronald Rosser. Mr. Rosser was born in Columbus in 1929. Joined the Army when he was only 17 years of age. In 1952, as a forward observer, and at the risk of losing his life, this is, of course, during the Korean War, disregarding enemy fire, he charged the enemy 3 times, killing at least 13 enemy soldiers, and while wounded, made several trips across open terrain, still under fire, to help remove wounded comrades. This courageous and selfless act earned him the Medal of Honor that was presented to him on June 27, 1952, by President Harry Truman. Our condolences to his family. Our thoughts go out, our prayers go out to our friends in Louisiana and in Texas, on the Gulf Coast of our country, as Hurricane Laura moves inland. I want to recognize the 84-member team from the Ohio Task Force 1, who should be arriving shortly in Louisiana to help with rescue efforts. Ohio Task Force 1 is one of the 28 urban search and rescue teams that function within the National Urban Search and Rescue Response System managed by FEMA. The team departed from its base in Vandalia, not too far from where we are. Fran and I are here in Cedarville last night, and they're made up of members from fire departments, local businesses, citizens from across the state. Ohio Task Force 1 is really an amazing asset on the federal, state, and local levels, and they have responded to major events such as the World Trade Center in 2001, the Columbia Shuttle debris recovery in 2003, the Haiti earthquake in 2010, and many hurricanes and tornadoes, including the Dayton tornadoes in May of 2019. We're very proud of this well-trained group, and we wish them well as they help out in the aftermath of this terrific, horrible storm. So let's take a look at our numbers today. First, with our basic numbers, we're seeing a slight increase in cases compared to last week. This is not surprising as more students are going back to school and people are moving around more. Sadly, we marked more than 4,000 deaths of Ohioans from the virus this week. We know that deaths from this disease lag, and we just are very sorry for these deaths. Let's turn now, Eric, to our top 88 counties. And again, to remind everybody what this represents, this is from the highest to the lowest just for the past 2 weeks, the number of cases, and it's calibrated per 100,000 population. What we're continue to see is a movement towards the rural counties. I think the top 14 are all rural counties. Top 10, I think, is all under 60,000 population. So we're seeing a real movement to our rural counties. Let's go to the slide with the top ones. This week, the top county is Henry County, followed by Mercer County. In Henry County, they've had 67 cases in the past 2 weeks, which has elevated their per capita case count. More than half of those cases are associated with an outbreak in a long-term care facility. While we know that long-term care residents are extremely vulnerable to the virus, we also know that the virus does not stop at the doors of the facility. As people travel in and out of the facility, people who work there, they can transmit the virus, which then translates to community spread. So it can go back, and obviously it can go back and forth. The best things that we can do to protect our long-term care facilities are for everyone to be very, very careful in the community. Stay home when you're sick, wear your mask, social distance as much as possible, regardless of whether you're visiting one of these facilities or not. These are certainly the best ways we can protect our communities as a whole. Let's turn to the color map now, Eric. And we have some good news and a little bad news. This week we have 6 red counties. This is the lowest number of red counties that we have had in the alert system since we started this 9 weeks ago. The 6 counties that are red are Mercer, Erie, Preble, Lucas, Montgomery, and Lorain. The big story this week is that we have 76 counties at the same level as they were last week, which is the smallest movement between levels that we have experienced so far. Montgomery County is the only county to move this week to red. We had 4 counties drop from red to orange, which is the good news. Those counties that dropped from red to orange are Claremont County, Clark County, Franklin County, and Trumbull County. This is also the smallest number of Ohioans living in red counties since the alert system launched, and this is certainly good news. However, we're keeping a very close eye on all of our counties. Colleges and university students are returning. We're already starting to see some cases as a result of that. We're also seeing, of course, our K through 12 that is starting back in. So we're at a time where we got to watch what's happening. Let me go through and talk about the red counties briefly. Mercer County remains red this week in the number 2 slot. While the county's numbers are trending in the right direction, it's certainly much too soon to let up. Even though cases have gone from 298.7 per capita in our alert system 2 weeks ago, it is 213.7 this week. And again, that's calibrated per 100,000 population. And so that remains over double what is considered a high incidence of the cases. During the past few weeks, the health department has been collaborating with their local officials to address the high number of cases in the county. They've implemented health guidance to help curb the spread of the virus. Let's go to Erie County. Erie County, they're at a level of 156 cases per 100,000 residents, again, in the last 2 weeks. They've had 116 cases during the past 2 weeks, which is a 15% of the total cases since the pandemic began. They've had a large outbreak in a long-term care facility that is now unfortunately spread into the community. Next county is Preble County. It is red due to a high incidence numbers. They're red because they meet the CDC's threshold for high incidence. They added 60 cases during the past 2 weeks out of 323 cases since the beginning of the pandemic. That's about close to 20% of their total number of cases. They have 2 significant outbreaks, and half of their cases are because of community spread. So Preble County, their number is 146 per 100,000. Again, that's about half again as much as the 100 level, which is considered high incidence. Let's turn to Lucas County. They meet 3 indicators. They're red because the county meets the CDC's threshold for high incidence. They're at 110. They added 473 cases during the past 2 weeks. They went from an average of 21 outpatient visits per day to 29 outpatient visits per day. The virus is spreading between members of the same household, and the county continues to have community spread. Montgomery County, they return, unfortunately, red this week. They added 538 cases during the past 2 weeks, which is 10% of their total cases. From August 16th to August 22nd, Montgomery County's cases increased from 36.9 today to 45 per day. They also saw an increase in number of outpatient visits, an early indicator. From August 5th to August 10th, they increased from an average of 50 cases per day to 60 new cases per day. Let's go to Lorain County. They are at 51 cases per 100,000, a lot lower than many of these other counties, but they do meet 4 indicators. They're making progress in the right direction, which is good. Their cases per capita numbers have been decreasing. Their outpatient visits also started to drop, again, an early indicator. Their average outpatient visits dropped from 26 on August 15th to almost 10 on August 25th. Their per capita measure dropped from 80 on August 20th to 51 as of yesterday. Yesterday, I was asked about Partners in Health, 2 days ago, on Tuesday, the Ohio Department of Health's contract with Partners in Health. This memorandum of understanding began on May 18th and was set to expire last week. However, the Department of Health is in the process of extending the MOU for 3 more months. Partners in Health is a nonprofit based in Massachusetts. They have global experience. For us, they have provided feedback, materials, examples of metrics to measure effective contact tracing, and they've shared best practices with us. They have provided these services free of charge, and our agreement going forward does not include any pay either. So we thank them for taking their expertise and extending it to us and serving as advisors and helpers as we move through this. We appreciate that very much. Let's talk for a moment about testing. One of the key components of managing the virus and taking care of our citizens is, of course, to have testing as widespread as we can make it. Testing allows us to isolate those who test positive, make sure they have access to health services, and also prevent the spread and transmission of the virus. Since the beginning of the pandemic in March, we've worked hard to increase our overall testing capacity, which has expanded. It has evolved over time, and we have expanded it, but we're not where we need to be, nor certainly where we want to be. It is a work in progress. The work that's occurred so far includes the tremendous efforts by the Ohio National Guard in taking testing into our nursing homes around the state. It has also included free pop-up testing, again with the National Guard, going into communities, and particularly underserved communities throughout Ohio. And I again would say to our mayors and our health departments, if you have an area where you need additional testing, where you don't think there's been enough testing, our National Guard can come in and do what we call the pop-up test, where they just set up for a day. Anybody who wants a test can get the test. We've also encouraged our retail partners to offer testing in minute clinics and grocery stores, just to name a few of the things. These are just some of the things that we have done. We need to keep pushing for new ways of testing COVID-19. And quite candidly, this continues to evolve. And we've seen now the private sector becoming, as we expected and hoped, become more and more involved. And so the testing is evolving as we move forward. I've talked to you before about our efforts around pooling. We have great hopes for pooling, and this is something that will expand our capacity greatly. A couple of weeks ago, I also announced Ohio's participation in a multi-state effort to purchase additional antigen tests and scale our ability to use testing as a screening tool. And again, we're looking at that and working with our scientists to determine exactly how we will deploy those antigen tests. No decision on that has been made yet. And last week, I announced that the state is working with assisted living centers on a new way of collecting samples using saliva instead of a nasal swab. I will point out that this testing, which is just it started, is the PCR testing, which is the testing that if you've received a test in Ohio, you probably had the PCR testing. We began this testing process last week. And what it does is it involves the local home, the local residence, the local facility of assisted living to be involved in gathering the sample. Some of our assisted facilities, living facilities, noticed what they felt were inconsistent results. And as a result of that, we've determined to start looking at this. So we paused this method of specimen collection for the assisted living facility testing temporarily in order to do controlled validation testing to see if the irregularities can be attributed to maybe the test kits, maybe the lab, or if it's an issue in the collection process. So we have some controlled testing that was supposed to start today. I believe it has started today. Will continue tomorrow. And we should have some results by late Sunday or Monday, which time we will announce those results and then make a decision in regard to where we move from here in regard to the testing at our assisted living facilities. I want to thank our partners in the assisted living community and the local health departments for working with us on that. Let's talk a little bit about schools. This is our K through 12. We know that schools are coming back last week, this week. We know that they're working very closely with their local health departments. We want to thank them for the great preparation that's gone into this, the collaboration between them and the local health department. I want to talk today about an order that we will be issuing to make sure that the public is in fact informed about what is going on with the students in the school, not by name, of course, but for the public to be able to understand if there is in fact virus in the school or if it's been associated with the school. Prompt reporting to the public, to parents, will help prevent potential further spread among students and staff, and it will also let the public know what's going on. So we'll be issuing an order that requires schools to establish a reporting mechanism for parents to report cases. We know schools have attendance lines where you can call and say that your son or daughter is not going to be there. This is where parents report if their children are going to be absent for whatever reason. This reporting mechanism could be that hotline if the schools want to use that as the hotline. That will be up to the schools. But parents need to be able to call into a school and say that their child has maybe tested positive or whatever the situation is with the child. within 48 hours after learning of a student or a staff member who has tested positive, our schools will have to report that case to the local health department. Now, some cases the local health department will have already known about it, but this is just to make sure, and so the schools will, as quickly as possible, report that information. Within that same time period, schools will make the information about a positive test publicly available, and they can choose how to do that. They can put a press release out, or they could post the information on the school district website, just some way so that the public is informed. Schools will also notify parents or the guardian of the child in writing, and they can do this by hard copy, or they could do it with a text, or they could do it with an email. Tell them about this and include as much information as possible, obviously without disclosing protected health information. Reporting illness to parents and guardians is nothing new for schools. They do it. There's head lice in school. You get, Mrs. So-and-so or Mr. So-and-so's class has head lice. You get the report. So this is nothing new, and this will not be unusual. The health department will then notify the local health department will then notify the Ohio Department of Health on a weekly basis about reported cases. So that will go to the state at least once a week from the local health department. And our state health department will then put that information up. We just feel that the more information that is available out there, the better. And let me just maybe state the obvious. If a community has widespread or has spread, and every community has some spread of the COVID, that will be reflected in the school. So the fact that a school has reports that there is COVID in the school, or a student or a faculty member or someone who works there, the fact that that gets reported should not necessarily cause any great alarm. Again, the schools are going to reflect what is in the community. So this is just a way of let people know, but does not mean at all that the school has done anything wrong. In the conversations I've had with superintendents and all the information I can gather, it looks like to me schools are doing the best job they can. Those schools that are open or that are on a hybrid system, they're doing the best job that they can on sanitation, keeping students apart, wearing face masks, and doing all the things that they need to do. So you can do all those things, and you can still have COVID in the school. And the real key, we've known all along, is how we handle it, how the school handles it, how the local health department handles it, how the parents handle it. So this really is a team effort. It's going to take everybody involved, and the better information that can come into that school, better information that can come to that local health department, we're going to be able to manage this better. They're going to be able to manage that better, and our school has a much better chance of being able to stay open. So literally, this is a team effort. It's going to take everybody in the community working. And if you don't have a child in school, you still can contribute, and that's wear a mask out in public and be careful so that we keep the spread down as much as we can. Well, speaking of our schools, we're going to go to Clark County. We're going to go to the superintendent of Tecumseh Local Schools, Paula Crew. Paula, thank you very, very much for joining us, and we appreciate it very much. You got your mask on there, I see, with the T. That looks good. You're unique, I think, in Clark County. I think you told me as far as how you were going back to school. I think are you totally virtual, totally remote at this point, or will you be?
Yes, Governor, we are completely remote at this point for the first 9 weeks of the school year.
And have you started back in? Has Tecumseh started back in?
Yes, actually yesterday was our first day starting back with our students.
And how are things going?
They're going very well. Large learning curve, needless to say, going 100% remote. I would say our motto right now is adapt and adjust as we come across barriers and find ways to avoid those barriers or solutions to those barriers, if you will.
So one of the things, you and I talked a week or so ago, and one of the things I was impressed by is what you told me, how you're handling your students who might have some special needs. Could you kind of share that with everybody?
Absolutely. So at Tecumseh Local Schools, we have approximately 660 students that have an individualized education program. And most of these students, a large amount of these students, are able to participate in remote learning if we have the proper support and services in place. So, for example, our intervention specialist and all of our general education teachers are working physically in the school setting, even though we're involved in remote learning the first 9 weeks. This provides an opportunity for them to collaborate in order to meet the specific needs and provide accommodations and modifications. And Governor, some of those, as I shared with you, include shortening their assignments, highlighting their texts, providing leveled reading to meet the students where they're at. And in addition to that, just like if the students were in the school setting, our intervention specialists have time built in their school day to work with small groups of students identified with special needs via a Google Classroom and a Google Meet. So they're having the same services that they would if they were, again, in the school setting. So we are using adaptive technology for our online learning tools, things such as voice typing, highlighting tools, and spell check. And so that's for the majority, Governor, of students on an individualized education program here at Tecumseh Local. Just like all schools, I'm sure, in Ohio, though, that are going remote, we have a group of students with intense special needs that really remote learning is not very, it's just not possible. These are students that may have hearing disabilities. These are students who may be nonverbal. They may have severe cognitive delays. So our plan, we had to think outside of the box, and what are we going to do with these students? What we've decided is we are literally one at a time bringing these students in on a bus twice a week to work with their intervention specialists, and to hopefully the goal is to receive while they're here their occupational therapy services and their speech and language services and their physical therapy services. So they'll have all of those twice a week within the school setting. Now, recognizing that the PPE is important, Mr. Charlie Patterson and his personnel at the Clark County Health Department have been wonderful. They've actually fitted our teachers, our special ed teachers who are going to be working with our students in the school setting with an N95 mask. And they've provided additional masks for us to use throughout the year as well. And so those are some of the efforts that we're making to, again, adapt and adjust, think outside the box to serve our students with special needs.
Well, that's great, because I know that these are the students we worry a lot about, and particularly when they're not actually in class. But it sounds like you've come up with a good way of making sure that we don't forget these students, and you're able to help them. So that's great. Let me just ask maybe a final question. And I know you've communicated a lot to parents, but what would you say just in general to parents? How can they help their students go through what is certainly an unusual situation, and the distance learning? What kind of help do you need?
In order to provide just the optimal learning environment for the students, we recommend that they have a quiet place in which they can work within the home. We recommend schedule. We're hoping to get back to school second quarter here at Tecumseh Local Schools. And in order to do that successfully, students are going to need to get up and eat a healthy breakfast and be on a regular schedule. So I think those are the things that we would recommend for our parents to be doing at home. In addition to, I have to stress, making sure that the social and emotional well-being of our students, of their children, are of the highest priority in conjunction with their academic learning. So reaching out if they think their child's acting perhaps a little different or showing signs of unusual behavior that they haven't had, We have an excellent team, Governor, of educators here, of staff members, specifically in this area, guidance counselors, mental health therapists, psychologists that are helping to support our students with their mental health needs. So we're also trying to reach out and help our students. We're doing the whole village approach, if you will. Our bus drivers, our paraprofessionals, our teachers' aides, some of our secretaries, our school nurses are taking a group of students and meeting with them individually. They'll have 10 students assigned to them, and they're going to meet with them individually via Google Meet one time a week. And that's to help make sure that our students know that they're connected with still, they're part of Tecumseh Local, that we love and miss them. So I think it's important for parents to be aware, again, of those changes that they may see in students and that they can contact the school immediately if they see those.
Well, that's great. Ms. Crew, we appreciate your dedication to young people, and please thank all of your team. I know it takes a team effort,
Yes.
And so this is very, very important. And it's been good hearing how you're dealing with something that probably when you went through college, you probably didn't think you'd be doing anything quite like this, remote learning for 9 weeks anyway. But you're adapting, and good luck to you and everybody at Tecumseh.
Thank you, Governor.
Thank you. Well, Ohio is home to so many great universities, both public and private, and colleges. Today, we're going to Skype in 3 college presidents to talk about what they did to prepare for the return of students, and just to ask them how things are going. There seems to be, as I have talked with college presidents, I've talked to a number in the last few weeks, a kind of a common theme of what is working. And just I've noticed some things. One, a close relationship among the village or city and the university. So that local community, talked with a number of the mayors this morning, in fact, but that close relationship is very, very important. Close relationship also that includes the local health department. Usually it's the county health department, or maybe the city health department. But that close relationship is very important as well. And a close tie-in between the campus police or the campus security and local law enforcement. Again, they always need to work closely together, but this is something that's even more important during this pandemic. So let me first start with Dr. Catherine Fell, president of the University of Findlay, to join us today. Doctor, thank you very, very much for joining us. And maybe if you could tell us a little bit about what your plans have been and how the reopening is going, and just kind of how you see things at this point.
Thank you, Governor. I'd be pleased to. The University of Findlay has made a successful start thus far to the 2021 academic year. We began classes August 17. Today is day 9 of classes, and we are offering those classes in several modes, as many as possible in person, in class, some a hybrid of both, and others fully online. The university offers online programs already, so all of our faculty have now prepared to offer all of their courses online if that is necessary, and of course in late spring it was necessary. But our Oilers Start Safe and Stay Safe plan has thus far served us well, with campus-wide adoption, of course, of the usual protocol, health assessment, we have an opportunity for everyone to do a health self-assessment tracking on an app that automatically notifies our Center for Wellness if a student or an employee is experiencing symptoms. Our UF All Hazards Training Center is of great benefit to us. It's nationally recognized for its development delivery of customized environmental health and safety training programs. So of course we're taking advantage of that right here on our campus and in our community. We've had a campus-wide adoption of physical distancing, disinfecting of hands and surfaces, facial coverings, and contact tracing. So to date, since the pandemic began back in the spring with force in our area of the United States, we have tested 163 persons with 15 positive cases since the beginning. And currently there are 5 individuals on our campus in isolation and an additional 10 individuals in quarantine as a result of contact tracing. And all of our positive cases, past and present, are doing well, I'm happy to report. So we will stay the course as long as it is safe and responsible to do so. The university's enriched our students' campus experience as we've adapted, as all of my friends whom you'll be speaking with today have done. We've adapted in allowing our students opportunities to build relationships with one another, with the faculty, and with our new students, with upper class persons, through adapting our usual opening of school activities. We, for example, had a drive-in movie night rather than an actual go to the movies night. During Welcome Week, we have outfitted all of our classes with Zoom and monitoring technology of first class order, and that's helped for those students who can't come to class. And then we've set up what we call Findlay Family small group opportunities for students to get to know one another and other people throughout the community. So I would say we've made a good start, and I'm very grateful to you, your administration, and to all the good people here on our campus and our community for going the distance and keeping faith with the protocol, even when it's inconvenient. Our students, I saw our student band practicing yesterday in the hot sun, no shade, with masks on. And I think if they can do it, we can do it. So thank you, Governor, for asking.
Well, Dr. Fell, thank you very much. My next question is going to be how the students are doing, and you kind of answered that with talking about the band. But how is morale with students? I mean, what
students seem really happy. I think with every week that passes, they'll be even happier. We're almost to the end of week 2, and they're delighted that we're not having to go home. And they're enthusiastic. When I see them, they have their masks on, but I can see them smiling. I ran across one of our students in the grocery store over the weekend, and with his mask, he was beaming. He'd had a great start to the school year, and I hope that story is repeated throughout campus.
Dr. Fell, thank you. We appreciate it very, very much, and good luck to you and Findlay.
Thank you.
Hope you all have a great year and stay in school. So good luck. Thank you. Let me now turn to Dr. Alex Johnson, the president of Cuyahoga Community College, Tri-C in Cleveland. Doctor, thank you very, very much for joining us. We appreciate it. How are things going?
Well, thank you very much, Governor, for having me. And let me extend my sincere appreciation to you and to Lieutenant Governor Husted and to Chancellor Gardner and to my dear friend Jack Hershey from OACC for the stalwart and steadfast leadership through this crisis and supporting community colleges without fail. It's been a tremendous opportunity, I believe, to really showcase what we do and to ensure that students continue steadfastly. We have done essentially all that Dr. Fell has mentioned with mandatory health assessments, in some instances mandatory temperature taking. Every student and every staff member that comes to the campus now must wear a mask, and I'm proud to say that throughout the summer and the beginning of the fall semester, which began this Monday, that no one has contacted any cases of COVID here at our sites. The other thing I will share with you is that we have created a significant relationship with Care Alliance, one of our healthcare agencies here, to ensure that our students, staff, and faculty and individuals in the community benefit from testing. And in fact, that's going on right now at our metropolitan campus. Among the things that I'd like to share with you is the importance of community colleges and continuing to provide support for workforce development. So throughout the summer, we had individuals come in that completed part of their programs remotely come to the campuses and complete their hands-on experiences. The first instance of that was with our police academy back in early May. We had 40 individuals being trained for the Cleveland Police Department who completed their training just about a week or so ago with no incidents, and we're very, very delighted about that. That gave us an opportunity to outfit physically to accommodate other workforce programs and also some of our allied health programs, most notably nursing. The one thing I can say about our students, just as Dr. Fell conveyed, is that they are truly, truly resilient. And while we have not adopted a particular motto or term alluding to the crisis that we find ourselves in, we still are relying on our strategic focus on access, equity, and success. And when you think about success, our students and faculty moved quickly to remote instruction. They did an admirable job in converting to that. And the outcomes have been tremendous, including increased graduation rates, increased graduation numbers. You may ask this question later on, but I'm going to get out a little bit ahead of you and say to you that even though our students are really responding to our efforts, we still have gaps that need to be filled in terms of students returning to the institution. And those students are most notably our Pell eligible or economically disadvantaged students, our students of color, and in some instances, high school students who have not quite made up their minds about where they need to go. So we need to continue to provide support to them in the form of devices, broadband access, emergency funding, and the kinds of things that would round out their educational experiences.
Doctor, thank you very much. You told me, I think, if I remember correctly, when we talked before, you deal with 50,000 people in a year's time.
Yes.
Who are getting something from the college, getting a degree or getting additional training. You and I talked, though, about the difficulty if you do remote for welding, something like welding or nursing. And can you just briefly tell me how you deal with that? And
right.
you said you brought people back during the summer.
Yes.
So as we now go into the fall, you're still going to be able to bring some people in?
Yes. And in fact, our idea, quite honestly, right now, Mr. Governor, we're at about 80% remote and 20% on ground. And that 20%, as I indicated to you earlier, is in our workforce area. So welding, for example, manufacturing, including mechatronics, which is a combination of different certificates.
Okay, you're laughing because I didn't know what that was.
I know, but that's okay.
That's why Dr. Johnson's laughing. So
that's okay. And so we're doing all of that, but we also can do, I think, a really better job in two ways. Number one, if we can figure out ways that individuals can develop these skills remotely. And this morning, I had a great conversation with our Mayor, Frank Jackson, and he's talking about the concepts not artificial reality, AR, in order to impart training, and we're looking into that as well. And the other thing is having training locations within the communities called access centers. And as I indicated to you on the phone, we have established one already on the eastern side of Cleveland, on the west side at Esperanza, close to Metro Health. We're looking to establish one in the Slavic Village area, which is an important community. And we're also looking to expand on what we do in the eastern portion of the county up in Euclid. So I think more remote instruction and hands-on and more community located centers like job hubs and access centers would be, I think, a great answer.
Well, that's great. Doctor, thank you very, very much.
Thank you, sir.
Good luck this year and good luck to all your team. We thank them for the good work they do. Thank you very much.
For your support, Mr. Governor.
Thank you. We'll go to Jim Tressel in Youngstown. President Tressel, are you there? Now we'll see if he comes up. Well,
Am I on there, Mr. Governor?
hey, Jim, how you doing?
I'm doing well, and it's truly an honor to be a part of your briefing. And I think I speak for all Ohioans that ever since the beginning of this pandemic, we've really looked to your briefings and your transparency and your leadership, and that of Lieutenant Governor Husted and YSU grad Dr. Amy Acton, and all of the people that we've grown to count on, and all of the various guests you've had as you've looked at every particular situation in our state. So it truly is an honor to represent the 14 four-year public universities here with you today. I can promise you that we've spent a lot of time together as public universities. I just looked back at my calendar, Mr. Governor, and we've had over 50 either conference calls, Zoom calls, WebExes, whatever it happens to be, ever since the beginning of time, making sure we were working together, helping one another, learning from one another. And there's no question that we feel strongly that this moment, higher education is being counted on. As you think about the frontline nurses and pharmacists and doctors and people that we're counting on to make that vaccine and all those types of things. And so we're working extremely hard to represent the higher ed publics here in the state of Ohio. And we're certainly very grateful to our students. As some of the other presidents mentioned, our students pivoted and went remote. And we were proud of them. We were proud of the faculty who had to make a quick turn in the middle of a semester. Our IT offices, our academic continuity teams, they just did an extraordinary job. And throughout the course of these 4 or 5 months, our workforce has made sacrifices in terms of some furloughs and unfortunately some layoffs. And it's been tremendous to see people's willingness to help us get through this. And as you mentioned at the outset, one thing that you have heard from most of us college presidents is that thanks to our city and local officials, most especially our city and local and county health departments, our folks here, I know, have been lockstep with us, working collaboratively with our people from our occupational, environmental, health and safety areas. They've been tremendous. And I know they have at all the other universities because we've talked a lot about it. And our group of folks is called the Inter-University Council, which is the 14 higher ed four-year publics. And Bruce Johnson is our leader, and Chancellor Gardner is with us night and day. And they put together safe return to campus protocols. And they spend a lot of time thinking about all of the various things. All of us universities have those pledges that ours is the Penguin Pledge, where we pledge to protect ourselves and protect others and protect the campus and protect the community, because we know, as the governor has talked to all of us a lot about, he's not as concerned about when we're on those courses as when we're not in those courses. And we've got to make sure we do a great job, of course, with our face coverings, with our distancing, and making sure that we do not have the large gatherings, especially off campus, and where we're all anxious because we're social beings, to be back together in groups. And we are preaching on every one of our campuses that we know how excited our students are to be here, and that in order to stay here, we've got to do a great job with that social distancing. So all of the help we've gotten has been amazing.
Mr. President, thank you very much for that a good summary. Talk to us a little bit about how your students are doing, what their reaction is, and how's it working?
This is our 9th day, Mr. Governor, and as Dr. Fell and Dr. Johnson said, it's amazing when you walk around campus how they all have their masks on. You don't even need to ask. You can see that they're staying, in social distancing. You can see the smile on the face. I think Dr. Fell mentioned that she saw the student in the supermarket and she could tell he was smiling. You can just see the twinkle in their eyes above their masks. They're excited to be here. They want to stay. And I think they're in this world of social media, Mr. Governor, they're kind of barbing each other, saying, hey, look, don't mess this up for us. Give us the opportunity to stay. And, so we're working together with all the campuses to remind one another they're excited to be here, and we want to keep them here.
Well, a little peer pressure always helps, I guess, right?
That's right.
And, recognizing that it's not going to be easy, but it certainly is possible to stay on campus, but everybody's got to pull their weight and everybody's got to be on the team. So any last thoughts for us? We appreciate you being here.
I would say this, Mr. Governor, we've really been appreciative, all of us, of the federal government and the state government with the CARES Act funding that you've been able to help us with, because it's expensive putting all these protocols in place. The first CARES Act, where we had a chance to really help our students directly, especially our Pell Grant students. So that has not gone unnoticed, and we appreciate it so much. And obviously, I'm sure I speak for the others. If there's any more of that coming along, we could certainly use the help.
Mr. President, thank you very much for joining us. We appreciate it. We thank all of our presidents who called in, but also the ones who are out there working every single day, and the faculty and the whole team with our universities. Ohio is just blessed with so many absolutely wonderful universities, both public and private, and we're proud of all of them. Let me go now to the Lieutenant Governor.
Thank you, Governor. It's great to hear from all those educators, the educators around the state who are just doing a fantastic job of helping students get back into making academic progress. I wanted to start on sports today. Little review on the sports order. As you know, Governor, we always try to pride ourselves on listening. When people ask questions or they want clarifications, we always try to respond, and that's what we're doing here today with the Department of Health, making a small change to what's known as the 24-hour rule. And the 24-hour rule was there so that we limited exposure of teams, that they weren't playing multiple teams in the same day. And how it will read is, it says basically, to limit exposure of players, sports participants shall not compete in more than one contest or game in a calendar day. We're changing 24 hours to a calendar day. No sponsor, owner, manager, or sports meet, event, tournament, or competition shall offer sports participants the opportunity to compete in more than one contest or game in any calendar day. Why? Well, it's just a logistics issue that some schools were bumping up against. They might have played a baseball game on a Friday night and wanted to play one on Saturday morning. That's obviously not 24 hours, but we didn't intend to prohibit this by a couple of hours. And so that's a way to manage it, to limit exposure and allow them to logistically make these things work. Additionally, when we say one contest, what that clarifies as well is you may have a golf team that will play a tri-meet, or a cross-country team that will do a tri-meet. That we used to say one team, we're talking about one contest. We want to allow those kinds of things to happen because we know that it just presents some complication in scheduling and things like that. And however, I want to add one thing here, is that it does not permit multiple contests in a single calendar day. You can't play multiple basketball games or volleyball matches or soccer matches in the same day. So it's focused on just the kind of sports like golf and cross country, where you may have a couple of teams participating and be able to do it safely. And I say this because, we got a lot of things going on at once right now, as you've noted on multiple occasions, Governor. We got school starting up. We're trying to get sports going. We're going to use this as a testing ground. We're trying to learn if we can get this right and see how this is transpiring over the course of the next couple of weeks. And we listen, and we'll try to adjust if things go well. But just understand that we're trying to go a little slowly here to make sure that this works, because ultimately this is about giving kids the chance to participate. And when they participate, they're going to transition to another thing I know you and I have had some questions on, is with spectators. Parents, a lot of questions, athletic directors, schools, a lot of questions. And I want to just read directly from the health order to remind folks about what the spectator provision is about. It's the primary purpose of permitting sports spectators is to allow and encourage the family and the household members and loved ones of players, coaches, team members, staff members, officials, and other event participants like the band or honor guard to share in that experience for those student athletes and student participants. And that's what we're trying to do here, because we've heard the questions. Well, hey, the way the rules are written, my family can't come see me. There are many ways which we can accommodate that. And I want to emphasize this once again. This is at the top of this section on sports venues and spectators. We want the families to be there. There are ways that you can do this by using lawns and standing room only in field areas allowable to the extent that they're 6 feet in distance and between 6 feet of distance between the groups and the patrons, and that's clearly marked. And remember, every school has to develop a plan and present it to their local health department. And so if you cannot accommodate the families under these rules as you see them written, or if you have questions, remember your local health department is there to help you do that. You can get a variance to make sure you can accommodate those family members. We want the families to be there so they can see their student athletes, and this order is written to accommodate that. And I know that we've had people ask about cross-country meets and football games and things like that. It's designed so that the families can be there. There's a way to do that. Work with your local health department if you have any questions. Additionally, we'll talk a little bit about unemployment compensation and the lost wages provisions that we've been working on. We received word from FEMA that Ohio's application was approved for federal lost wages supplemental payment assistance, and we will receive a grant for $717 million to provide additional assistance for eligible individuals. This is what the president allowed in his executive order that you recall from a couple of weeks ago. And this grant will allow Ohio to provide an additional $300 per week to those receiving unemployment benefits because of COVID-19. So that's good news for those folks who've been wondering about that. Ohio got approved, and Ohio is we're going to administer this assistance program through the Department of Job and Family Services, and payments will be retroactive to August the 1st for those who qualify. So if you've been wondering, Ohio's approved, those are going to be retroactive to August the 1st. So I know that there are a lot of folks that will be helped by that. Also, Governor, we got a question the other day about what are we doing to help people who may be unemployed or underemployed. People are at the low end of the wage scale or perhaps living in poverty. We got a whole list of things that are available for dislocated workers, training services, retraining, support services for people who need them to get access to that. Programs that for the underemployed and the unemployed. We even have programs targeted for this group between the ages of 14 and 24, career services, career guidance, job search, job placements. These come under a variety of programs. And so we want to make it easy for you. I know that when you're trying to navigate government, it can be hard. You hear all of these different programs named. We have one place right here. We got a website for people to go. I was going to read this, Governor, and I thought, you read these websites, it's hard for people sometimes. We'll post this on social media, but here's the website. And anybody who is seeking job assistance, needs support services to try to get back into the workforce or maybe upgrade their work skills so that they can earn more. Right here is the website where you can go get those services, and we want to help you. We want to help you move forward, climb that ladder, climb that mountain. There are literally people whose job it is to help you get a job and to improve the job that you have, and you can find them through that resource. Which also brings me into a reminder, we had it set a goal, Governor, on tech cred to try to upskill 10,000 people with tech skills. We're on the path to do that, but the application period is closing on Monday, August the 31st at 3 p.m. So for those of you who want to upskill your workforce, remember techcred.ohio.gov is a great place to go do that. Please take advantage of it. And you can go to many of these fine institutions that we were just talking with. I know that there are a lot of folks who are accessing the services at our community colleges and our universities and our colleges. So please make sure you use that resource. And then lastly, duplicate payments. You know, the Innovate Ohio team has been continuing to try to use technology to make sure that we found tools to stop these duplicate payments and sometimes expenses that get out the door that shouldn't. Just an update on that. We've already saved over $1.1 million and stopped over 145 duplicate payments at 29 different agencies. So that Innovate Ohio platform that we talked about and how we're going to improve services to our customers and continues to evolve and grow, Governor, and we're seeing some results. So, and by the way, I saw Dolly sneak into the set there just a little while ago. I could see her tail, so you took it right in stride.
I put her. She is sleeping. She's sleeping between the two flags right now. So yesterday was dog day, so we forgot to say anything about dogs and everybody who's got dogs. Let's go to questions.
First question today, Governor, is from Jackie Borchert at the Cincinnati Enquirer.
Hi, Governor. New CDC guidance released this week said that close contacts of people with COVID-19 do not necessarily need a test if they do not have symptoms. Should Ohioans without symptoms be tested? And also, what caused the big jump in the number of tests today?
I can't tell you about the number of tests today. You talking about the number of cases?
No, the number of tests reported was more than 68,000 more than yesterday. That's like 3 times.
Yeah. Yeah, I don't know. We will check on that and see if we can find an answer to that. As far as the CDC, my understanding is they're continuing to clarify that today. An hour or so ago, there was some clarification, but we see no reason to stop basically our protocol and our policy. There certainly are instances where you want to be able to test people who do not have symptoms. I mean, one of the things that we know, particularly, let's take going back to college, we know that among young people, say 15 to 30, symptoms many times don't show up, but they can be carriers. They can have that. So we think the protocol that we have today is correct. We do not want to give up the ability, or we should not give up the ability, nor do we want to go into an underserved community and just not require the symptoms, not require people to prove that they've got symptoms or if they've got doctor's order. I mean, opening this up, I think, has been very, very helpful. And you're going to continue to see, as I talked about earlier, the ability to expand testing. Testing is going to get cheaper. It's going to get quicker. And we need to use every single tool that we can to do the testing and then to do the tracing. We got to run this disease down. We got to cut it off, and we got to do what we have to do. So we do not intend to change what we're doing.
Next question is from Jeff Reddick at WSYX in Columbus.
Hi, Governor. 2 things. Quickly, I wonder if you would comment first on Franklin County coming down out of the red, which is quite a success for Franklin County. Secondly, the RNC is going on this week. You're probably the most visible Republican governor in the nation as far as coronavirus, and we haven't seen you have a large role in that convention. I wonder why not.
Well, I can't tell you. I certainly support the president. Sean and I are part of the co-chair team for the president here in Ohio, and so that's very, very much behind the president. But we're focused on what we have to do here to get this economy moving. We've got to keep the virus down. We're going to every single day focus on that. We celebrate Franklin County. I know Mayor Ginther and council and the county commissioners and everyone is very, very happy today. But look, it's a long struggle. It's a long struggle. Franklin County has been red since the beginning, since we started doing this. We really started seeing a change when Franklin County when the city of Columbus put on a mask order, then we put on a mask order that covered the whole county and other red counties. That was really the break point where we started to see the use of masks go up dramatically. And when that use of masks went up dramatically, where you're getting 90% or so, we started seeing a slowdown and then a starting to come down in the number of cases. So still a lot of cases. It's a big county, but we're moving in the right direction. Very, very happy about that. The battle is still going on here. You can't say it's over with, but we're very happy with what we saw. And we should celebrate this. And the people of Franklin County should celebrate. Look, this is not something that the mayor did or that the governor did. This is something the people of Franklin County did. And they did it by focusing on keeping distance and wearing masks and doing what had to be done.
Next question is from Jake Zuckerman at the Ohio Capitol Journal.
Hi, Governor. This question hasn't been updated with today's numbers, but where things were yesterday, Ohio was set to fall short of testing estimates that it sent into the federal government, and you described those estimates as too low for this month. So how will Ohio get its testing numbers up, and why has that not happened yet? Is there still a choke point that's holding things up?
Yeah, and this is not the entire reason, but as you know, Ohio has never been red hot. At no point during this have we been on fire. We've been where we were concerned, but Ohioans stepped up, did what they had to do. The downside of that is that when decisions are made, for example, on reagent, does it go to Ohio or does it go to another state that's has a lot more cases? It goes to the other. So that's not the entire reason. But if you talk to the hospitals, you talk to some of the people who rely on reagents and other things, what they will tell you is it gets rationed. And so that has been one of the challenges. We're going to break out of this. We're not where we want to be. I've been very clear with that. But we are going to break out of this. What's the pooling process that's starting to occur at Ohio State? We hope to take that throughout the state to a number of different labs. We have other contacts with other companies to do additional testing in Ohio. But let's be honest, when you start new testing, sometimes there's a glitch like we talked about today. And we are not going to wait until until it's 100% we know it's going to be perfect. We're going to take some chances. They're going to be calculated chances, thoughtful chances. But when you move to new testing protocols, sometimes you run into a situation like we've run into in regard to our assisted living. Once that is ironed out and figured out, that's going to increase testing rather dramatically. We want to take testing in our nursing homes that now is at 2 weeks, every 2 weeks. We're going to take it down to 1. And if we have the ability, we're going to take it down even lower than that. So that's where we're going. We're not happy where we are, and we're not satisfied, and we're going to keep fighting.
Next question is from Ben Schwartz at WCPO in Cincinnati.
Hey, Ben.
Hi, Governor. I'd like to ask if you have a comment on Lebanon schools, as they've recently had to quarantine a number of students along with hiring their own contact tracer for the district. I'm wondering if you have a comment on this idea of hiring a contact tracer and if you'd recommend that to other schools to see them do the same.
Well, I don't know all the facts about, I've read about Lebanon and challenges they've had, but as far as contact tracing, I don't know. Ideally, what we're seeing is our universities at that level. We're seeing universities becoming very involved in contact tracing. Now, that's usually under the umbrella of the local health department, but sometimes they will get students who get trained, and then they become part of the contact tracing system. So at the college level, we certainly have seen that. I'm not aware of anybody else doing it at the K through 12 level. It could work, and if it works for them, that's great. We've made it very clear to every health department in the state that we have tracers that are there to work with the local health department and fill in the gaps when the local health departments have got a surge and they can't keep up with the surge. So I'll check into that, what's going on with the school, and see what we can learn.
Next question is from Max Philby at the Columbus Dispatch.
Hi, Governor. With the data that the state will be reporting on its coronavirus.ohio.gov website, how granular will that data be in terms of school and district? And then secondly, why give 48 hours to report that data when the virus could still be spreading in that time period?
Well, it needs to be reported immediately. It needs to look, I mean, if the parent has the information, we want the parent to, get that information in. Look, if there's a test, it's going to get reported immediately. If there's not a test, but child has been quarantined for other reasons, that information needs to go into that school. And we're asking the schools to make that information public and to put it on their webpage, or to send out letters. If there's an outbreak in a third grade class, or let's say it's an outbreak in a high school, the school needs to get that information out to the parents, certainly all the parents of children who are in that building. So it's building by building. But the big data needs to then, of course, obviously goes to the local health department, then the local health department, it goes to the state. But the whole idea is to be transparent about how we're doing this.
Next question is from Spencer Hickey at Hannah News.
Thank you. Governor, the Ohio Chamber released a business survey today that found economic conditions have improved since the first quarter, but remained below average. If you and the Lieutenant Governor could discuss that.
Well, sure. Again, the most important thing we can do is try to give people confidence. And the way we give people confidence in what's going on in Ohio is to keep the virus down. I'm optimistic about our future. We're seeing our unemployment numbers down, but obviously we're not where we want to be. And we're going to continue to, keep the virus down and let our businesses continue to grow. John, want to add anything?
Yeah, sure, Governor. Look, this is going to be a battle for a while. It's going to take time for the economy to recover when you come through a pandemic. The virus isn't going away anytime soon. The question is, how can we manage it in our lives? We've found a pretty good balance with it. There are restrictions, but mostly everything's opened up. Our employers are doing a great job of keeping the virus down in the workplace. Our unemployment rate is below the national average. We're planning every day on what we're going to do once life gets more back to normal. We're pushing forward with broadband. We're pushing forward with job training, particularly with tech skills. All of those kinds of things will hopefully position Ohio well as we come out of this. But this is going to be a battle for a while. And I think that Ohio is well positioned. As the governor alluded to earlier in the day, we got out in front of it earlier in the news conference. We got out in front of it early. We didn't have a second huge spike like they had in some of the southern states. We didn't have huge problems at the beginning like they did in some of the eastern states. We've kept it under control. The job is to manage through that as effectively as we can until a vaccine or other therapeutic solutions come along that help make it less of a threat in our lives. And every single day, the team's working on it.
Yeah, let me just add, we believe we can do two things at once. What you saw, one of the reasons I want Dr. Johnson on from Tri-C, large number of young people and not so young people are being trained there. We did not back off. We did not say, we can't do that. They didn't do that. They ran right into the storm. They basically said, we can do this. And they continued on and are continuing to educate young people and older people and preparing them for real jobs in our economy. So we're pushing forward.
Governor, your next question is from Laura Hancock at cleveland.com.
Hi, Governor. The Cleveland Browns have released a pretty detailed plan about how they're going to proceed with the football season, and they have sent it to you asking for your approval. Have you reviewed it? What do you think? Do you think you'll approve it? What are your thoughts?
Sure. Thank you very much for all Browns fans and Bengals fans. Both have presented very good plans, plans that we think make a lot of sense. As the Lieutenant Governor indicated, though, we got a lot going on in this state. We're opening up schools still. That's going on. Our colleges are opening up. We got to take a deep breath. We got to see exactly where we are before we make any decision about professional sports having fans. But it's a good plan. The Bengals have a good plan. The Browns have a good plan. You know, one of the things that they are looking at doing would be to have 4 different groups. So you would enter and exit in that one area. But if you're another group, let's say group 1 would not come in contact ever with group 2 and 3 and 4. And so, you know, they hold, 60,000 or so fans. So there certainly is possibilities as we look at the season to do something. It would certainly be at a much reduced number of fans. But look, they've both been patient, and more importantly, they've come up with plans that are actually doable plans, very professionally done, very, very thoughtful. So not there yet, but we're going to continue to look and see maybe at what point we could do this. So if we can keep things moving forward in Ohio and this virus doesn't spike up too much, it certainly is a possibility.
Next question is from Jack Windsor at WMFD in Mansfield.
Hi, Jack.
Hi, Governor. Hi, Coach Tress. Sir, thank you for the update on Partners in Health. Very tough question for you today. People who believe legitimate scientific, medical, and data sources that are different than this administration's experts have been criticized as being part of the COVID problem. On Monday, Representative Vitale was a vocal proponent of articles of impeachment released against you. On Wednesday, he became the target of the Secretary of State for alleged campaign infractions. Others who oppose you strongly, they were stung. Senator Brenner, protesters that opposed you were heavily shamed, while protesters for your cause, despite doing much damage, were hardly scoffed. I was the subject of a hit piece that this administration not only gave the journalist my contact information, but immediately honored a records request that produced one of a dozen messages I sent to Lieutenant Governor Husted, while I had to wait over 3 months for my records request to be honored. Governor, I have a hard time believing that this is intentional, but it's hard to ignore. The line that opposes you is full of people who've been investigated, bullied, blamed, and shamed. To some of our viewers and readers, this looks like mafia politics. What would you say to those Ohioans? 83% who agreed you should be removed from office in what was the most heavily covered poll ABC 6, Fox 28 has run this year. Thank you.
Well, thanks, Jack. First of all, I don't know in regard to you personally what you're talking about. We've always welcomed you to these press conferences, and you know, you've had the opportunity to ask plenty of questions, and you're going to continue to be welcome, and you're going to continue to be able to ask questions on live TV that anybody can watch. And I know you have a following out there. I can tell by the texts I get and the emails I get. So I don't know about that. Look, I found out about Representative Vitale the same time probably everybody else did. Actually, it was last night when I found out about it. Somebody told me about it. So I don't know anything about that. Absolutely nothing about it. So as far as protesters, look, we've had protesters outside our house, out on the road, on several different occasions. We've had protesters at the State House. We had protester at one point, I think, was trying to climb through the window in my office, I'm told. I wasn't there. So look, protesters can do, as long as they don't resort to violence, they can protest me, they can protest Dr. Acton, they went to her house. So I don't think anyone's First Amendment rights have in any way been impaired. This is, people have the right to file things, impeachment. As I said 2 days ago, they should have at it. I mean, they do what they do. My focus is going to remain on getting Ohio through this, There's going to be a bright future out there for Ohio after this is over with. We got to keep things going. We got to keep the fire down. We got to save as many lives as we can save. We got to educate our kids. We got to put people back to work. I mean, these are the things that I'm focused on and the Lieutenant Governor is focused on absolutely every single day. Finally, as far as the medical advice, look, we get the best medical advice we can get. If there's medical advice out there that we should be listening to, we are happy to listen to it. We go to Ohio sources. We go to the Cleveland Clinic. We go to UH. We go to the children's hospitals throughout the state. We go to Ohio State. We go to the University of Cincinnati. I mean, these are credible places with very, very, very credible people. And these are the people that we are relying on. We are relying on the best minds in Ohio and across the country in the medical community and the public health community. And we're going to continue to do that and make decisions based upon that. Thank you.
Next question is from Kevin Landers at WBNS in Columbus.
Good afternoon, Governor.
Hey, Kevin.
Hi. Governor, Franklin County has seen 4 weeks of declining numbers. And is it time that city and county health districts and school districts begin shifting strategies, perhaps away from masks when they go from red to orange to yellow? And if counties go from red to orange to yellow, parents are going to want to get their kids back into the classrooms. What's your take on this? What is the barometer by which you believe it's safe for kids to go back in the classroom? How many weeks of downward numbers does it take for that to trigger? Thank you.
I don't think there's any magic, Kevin. I don't think there's a magical answer. To take your first question, unless I misunderstood it, in regard to masks, social distancing, the current strategy is working. There would be no reason to stop that strategy. In fact, we need to double down the strategy. I've talked with the mayor this morning, Mayor Ginther, we're still seeing examples of people, unfortunately, who are not social distancing, who are very close together. And that's worries the mayor, it worries me. But overall, Franklin County has done well. And so the strategy that Franklin County has, you've got a good health department, county health department, you got a good city health department, and they got a mayor who's very, very focused on this, and the other mayors. So look, I think that we're moving forward in Franklin County, and we should just continue to do what we're doing and continue to try to get people to not congregate together. We're in Franklin County, just as in other counties, we're seeing an uptick, significant uptick among those 18 to 35. We're certainly seeing those numbers go up as a percentage. So that remains worrisome. As far as when schools should return, that's up to the schools. That's up to the schools. And what we have not told schools what to do. Look, we have some schools in some of the parts of the state that are in red counties, and they've opened. I've cautioned them about it. I've said, look, you're going to have to be very, very careful. You're going to have to watch it. But we've not stopped them from doing that. What I have tried to do is to give them the best evidence and best information that they can get. So if you live in Franklin County and you see it has dropped out of the red, that's a good thing. I think the schools themselves and the parents and the families should make the decisions about, does that mean we switch over or not? I think, again, you want to see a sustained trend, but ultimately that decision is up to the local community.
Next question is from Adrian Robbins at WCMH in Columbus.
Hi, Governor. I also have a school-related question. When it comes to this new alert system, I understand the importance of being transparent and alerting parents of a positive case, but at that point, what is your advice to parents and for teachers? It seems unrealistic that they could quarantine an entire class or for a teacher to quarantine every time they have a positive student. So other than worry, what can they really do with this information?
Well, I'm not suggesting they do this, but one of the things in most schools, they have the option of going remote. if they want to do it. Now, some schools have said, no, you can't do that in the middle of the term. But again, I think information in the hands of parents is always good. Parents are the first teachers, the best teachers. It's their children. They are the ones that should, know everything. And you just don't want a situation where parents don't know anything. And schools, I think, generally do a very good job. If there's a problem in a certain class, note comes home, and there's a medical problem here, and check your daughter's and your son's hair for lice. I mean, whatever it is. I mean, anything can happen. Doesn't mean there's schools doing anything wrong. Stuff just happens. That's just more information is, I think, the most important thing for parents. As far as quarantining a whole class, look, these are clinical health decisions that have to be made in conjunction with the local health department. And generally, my understanding is that the more information that's there, the more people are forthcoming, the more people, who come forward with information, the better able the health department is to determine a smaller number of people who need to be quarantined. So it's when they don't have the information and people aren't cooperating that many times you'll see a whole block of people that are quarantined, and that's not what we want. We want to be surgical. We want to be, based upon the best science.
Governor, next question is the last question today, and it belongs to Andy Chow of Ohio Public Radio and Television.
Hey, Andy.
Hi, Governor. Also a question regarding the school notification system. When you do put out the health order, are you going to be spelling out any specific privacy guardrails, anything that you specifically want schools to make sure that they do not report in order to protect a child's privacy?
Yeah, Andy, I mean, we wanted to put this out today, even though the order has not been written, because I wanted to give schools notice, parents notice. We want to give them the early information. So that will certainly be in the order. We will comply, and we'll spell out what federal law is. We'll spell out what state law is, and certainly, we do not want to infringe on people's right of privacy. On the other hand, we want to make sure that parents have some information that they should have. So we clearly are going to protect people's privacy and people's individual health information.
Thank you.
Thank you very much. Today we have a video featuring the members of the Martin Luther King Jr. Celebration Chorus, joined by students from Cuyahoga Community College's Vocal Arts Mastery Program, singing the gospel favorite, "Oh Happy Day." Martin Luther King Jr. Celebration Chorus is a volunteer community chorus assembled each year since 1989 to sing as part of the Cleveland Orchestra's annual Martin Luther King Celebration Concert. Bringing together singers from across Northeast Ohio, the chorus lifts its collective voices in affirmation of Dr. King's vision of justice, peace, and human harmony. Eric?
Even though we are apart,
we are together in spirit and in song.
Today we celebrate love, resilience, community, and the power of music. Oh, happy day.
Oh, happy day. Oh, happy day. Oh, happy day. Oh, happy day. Jesus won. When Jesus won. Jesus won. When Jesus won. Jesus won. When Jesus won. Can you watch me sing the joy? Oh, happy day. Oh, happy day.
That was great. We will see you all Tuesday.
Governor Mike DeWine finishing up his coronavirus briefing. Right now, here are Thursday's numbers. 118,828 total reported cases. That's up 1,244 from yesterday. 107 more hospitalizations and a total of 4,076 deaths, 32 more reported in the last 24 hours. Big news for Central Ohio. We're at the orange level. Franklin County dropping today. Only 6 Ohio counties remain in the red alert level. That's level 3. So that number, though, is the lowest number since the map was created on July 2nd. But cases continue to rise in the rural counties. The governor talked about how Ohio needs to keep pushing for new testing methods. He says that the state is looking at a multi-state agreement to get antigen tests and is still looking at pooling tests. The governor also outlined how schools will inform the public about coronavirus cases. They must first alert the local health department and then publish the information on their website. A slight change was also made to the 24-hour sports rule. Now, athletes should not compete in more than one contest in a calendar day. So, teams can now have a Friday night game and then a Saturday morning game. It does not allow the team to participate in multiple games in a single day. If you missed any of the news conference, watch it on our website, abc6onyourside.com, and on our YouTube page, search for WSYX. Also breaking, Columbus City Schools making a major announcement right now about in-person athletics and activities. So let's go to that.
If you need me to allow you to record the meeting,